Cholera. Let's talk about it. First things first, what is cholera? Cholera is an infectious and often fatal bacterial disease of the small intestine, typically contracted from infected water supplies and causes severe diarrhea and vomiting, which leads to dehydration. Cholera is best treated as soon as symptoms are observed. So the signs and symptoms of cholera include profuse watery diarrhea, sometimes described as rice water stew, vomiting, thirst, leg cramps, restlessness or irritability. You have been informed. And now the do's and don'ts when you suspect that you have cholera. The don'ts. Do not try to treat the diarrhea with anti-diarrhea medicines, or else you risk reinfection, which can have worse symptoms. Do not keep your water stores open. The do's. Be sure to drink chlorinated or water that has been brought to a boil. Wash your hands often with soap and safe water. Use toilets. Clean up safely by disinfecting your cooking areas, the surfaces in your toilets, and your body, including the clothes that you may be wearing on various occasions. And finally, boil it, cook it, peel it, or don't eat it at all. And now the myths and misconceptions surrounding cholera. Stick around for the fourth one because it will blow your mind. Number 1. If left untreated, cholera can kill you in a space of hours. Number 2. Safe water, whether treated with chlorine or boiled, is still at a risk of contamination if not stored properly. Number 3. It is possible to go for up to 10 days with cholera bacteria in your fecal matter without even noticing. And during this period, dissemination or spreading of the bacteria would have taken place. And number 4. Fever in a cholera patient is rare and should raise suspicion of secondary infection. Now onto management and treatment of cholera. There are two main aspects of management and treatment of cholera, and these are rehydration and use of antibiotics. In rehydration, we use ORS for people who can take it, and for those who are unconscious or unable to take ORS, we inject fluids directly through their veins. Main antibiotics used in most standard treatment guidelines, including the World Health Organization guidelines, are tetracycline, azithromycin, ciprofloxacin, and doxycycline. But of course, the choice of antibiotic used is dependent on the sensitivity patterns. Caution, please do not self-prescribe. Why is cholera referred to as the Blue Death? Cholera was nicknamed the Blue Death because a person's skin may turn bluish-gray due to extreme loss of fluids. So, patients may turn lethargic, which seems to refer to lack of energy. So, some might have sunken eyes, dry mouth, cold, clammy skin, or wrinkled hands and feet. The 3 C's to kick out cholera. Number 1. Clean water. Drink and use safe and clean water to brush your teeth, wash, and prepare your food. Number 2. Clean hands. Wash your hands often with soap and safe water before, during, and after preparing your food. And number 3. Early care. Seek care early for you and your loved ones at the earliest signs of diarrhea, even before one develops dehydration. Don't miss out on more informative content. Follow me on all social media platforms at Pharmacist.